think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
BVA accepted the veteran's testimony that the first exam was not accurate and ordered a second exam. The second exam that was acquired, therefore, replaced the results of the first exam, which is no longer for use because BVA found it to be inadequate. So the second exam goes retroactively to the original date of claim, and that's why.
Oh, I understand. Therefore, they wouldn't have ordered the second test had not the first test been protested.
Another way of saying it, if BVA was satisfied of the adequacy of the first exam, there would have been no need to order a second one.
That's correct. That's
unless now, there are exceptions to that rule, unless the veteran comes in and says his hearing got worse after his last exam. Okay?
True.
In that circumstance, there would be a later effective date associated with that. Again, based on the facts found.
What was that year difference, Bill, between the first exam and the second exam?
No, in each case, what I have to do, what I used to do in each case, I would review those examinations, and I would decide whether the first one was adequate or was not adequate. And if it was inadequate, that means I can't use it. So the second exam is the first time VA got a proper exam, and that applies to the whole claim period.
That's an important point, because when I review the records, oftentimes I'll see that the examiner or the audiologist or even other parts of the record will say that the patient wasn't cooperative, the exam's not quality, and I can't make a determination. So those exams should be nullified and then redone with effective date. That's a good point.
If it's nullified and has to be redone, then by all means, you have to give that veteran the benefit of the doubt. You have to take it all the way back, in my humble opinion, in many cases. Okay? Mm-hmm. Now, the manual again, and the reason I keep going back to the manual is VA has placed so much emphasis on the manual as being the source of guidance for making these decisions. And so I go back to the manual a lot. And just lost the total point I was going to make, but what the heck. Sorry about that.
Hey, Bill, how many years was there between the first exam and the second one in your example?
It'd be about 5 years.
That would be about average because it takes about 5 years for BVA to make a decision. The cases I got on remand typically were 5 to 12 years old.
Wow.
Yeah.
Let me shift gears a little bit, Bill.
Okay.
How much experience do you have dealing with claims that are filed based on 3.156C for appeals?
It comes up occasionally. Yeah, it comes up occasionally.
Dr. Bash here, I don't know what that means. Can you guys explain that 3.16?
Sure. The regulations governing the reopening of claims impose a requirement for new and material evidence. Once you lost the claim, it's lost forever. And then, if you file it over again, you must submit or you must point to new and material evidence to reopen that claim. And the effective date would be generally when you filed the request to reopen that claim. Now, there's two exceptions. The regulations found at 3.156, and in one section, that would be section B, if that new material evidence is presented or the attempt to reopen is done before the decision becomes final, that is within a year or before a BVA decision on it, then you preserve the effective date associated with the prior claim. If you miss that 1 year, or if you get a denial by BVA, then you start over from the date of reopen claim. The second exception is at 3.156C, and this applies to those cases where the claim is reopened and granted based on additional military records. And the premise is those military records existed at the time of the old claim, but for some reason were not acquired, were lost, were misplaced. So 3.156C says if you find those military records and use those military records to reopen the claim, it goes back to the original claim because those are predicated on military records. And I've granted more than a few of those myself and argued and won several cases for it as well. I could probably come up with some examples if I put my mind to it, but that's the basis of going back retroactively with 3.156C.
Okay. We've had a lot of discussion on it. A lot of folks were discussing that issue and couldn't find the records, and they filed a claim, and claim got denied based on no service records, and a couple years later,
and then you go to your congressman. The congressman. Yeah. You go to your congressman. The congressman helps you find them. You come up with those military records, establishing the fact that we're searching for based on those military records. It goes back to the original claim.
Yeah. Now, there's a lot of cues involved with that. I'm thinking about one myself here pretty soon, so we'll figure it out.
Well, actually, that's clear and unmistakable error is a much harder case to win than a 3.156C.
Right.
You don't have to prove that the original decision was wrong for your 156C. You just have to find the evidence and turn it in. And you're entitled to it.
Basically, you're saying an earlier effective date claim would be easier than filing a Q based on 156C. Okay.
Absolutely. If you get those, that's just terrific.
Touch it a while ago when we were discussing aggravation. Does the regulation still state that the VA will only pay to the extent of the aggravation of the issue that's been aggravated? Does that still say
the rule,
that they change
yes.
that wording? Okay.
No, that's still the rule. Still the rule.
Yeah, and I went to the University VA at Hard Rock.
Yeah, let's say you had a 10% back, but you have a severe limp from a service-connected knee, and that aggravated it to a 20% back. You would be paid the 10% difference.
That makes a whole lot of sense.
That's rather similar to a patient or a veteran who comes into the service with a disability, but it's not disqualifying. Okay, so you're enrolled, you go in with a 10% disability, maybe flat feet. Okay, just an example. So okay, everybody agrees you had 10% flat feet when you enlisted. But after a few years of marching and running and everything else, now you've got 30% flat feet. Okay, you get 20%.
Makes sense. Makes a lot of sense. Here's a good hypothetical to run by you. This is a true story, true statement. Navy veteran. The Navy vet who was actually the tail hook we were talking about earlier didn't catch and about got him. The this vet was witness of an aircraft accident and filed a PTSD claim. And he filed a Social Security claim basically about the same time, but Social Security was faster than the VA was in his claim. And he used the VA doctor's report. Social Security said that he was totally disabled, could not work due to his post-traumatic stress disorder and anxiety disorder due to the incident he served and was involved in the military. So,
and let me guess,
so Social
based
Security
on
awarded
Social Security awarded it based on the VA records.
That's right, and the VA doctor.
Yeah,
Okay.
I see that
and,
so often.
He filed for an IU claim, but he wanted Social Security from the same doctor that got his IU, but the date from the onset for his Social Security and his VA disability is a year apart.
Okay.
So he went back and he's thinking that the date it was weird.
Yeah, there are so many variables. Okay. At what point in time, whether he was working or not, at what point in time did he become unable to maintain substantially gainful employment? And that might be different from the last day worked in some cases. When it comes to unemployability, or for a total evaluation for a mental disorder based on the fact that he's totally disabled, the day that actually happened, that is what our responsibility is to find. Find that day and grant it. Okay. I used to use an acronym for that. Let me think.
Yeah, we call it
happened. TDIH, the date it happened.
Yeah.
You know, the date it happened.
The date it occurred.
Not the date you got the application for IU, not the date the examiner said so, not the date Social Security determined it, but the day it happened. Okay?
That's the day it wrote.
A vet might have been working and gone on sick leave for an extended period of time. Well, during that period of time, he's still employed, and I see a lot of unemployability claims granted as of day after the last day of employment. All right, well, maybe not. If he spent that whole time on sick leave, then he was not capable of maintaining substantially gainful employment. He was just riding on sick leave. So when did he go on sick leave? That might be the date. Or the date he last actually showed up. That might be the date. But there's plenty of variables to pick from.
There's all kinds of variables. Okay.
Yeah.
That's one that kind of sticks in the back of your throat, when you say, what? No. Dr. Bass, you got any bulleted points you want to discuss?
Well, this whole thing about development, that's really important because, Bill was talking about how the raters are not developing much and, the DROs aren't developing too much. And even now, I guess at the old AMC, you were saying that they've been kind of limited on your development, right, Bill? Because those are the guys who come out of the BVA. So if they're not developing anywhere in the whole system anymore to try and streamline, then we just really have to make sure we do the best development we can on the front side. Right, Bill, you want to talk about that a little bit? The development is so important.
Very much so. And realize that it's extremely difficult for VA to catch up with the claims. You've got to crank fast. You've got to go fast to try to get these cases addressed. I mean, take a look at those appeals. The data indicated that a lot of veterans who have appeals pending will die before they're reviewed. And that was part of the motivation to ramp things up and get it moving. And so if there's something you can do to relieve VA of the burden and the time it takes to find your evidence, and you take and give it to it, that'll expedite your outcome. Look, simple comparison. Let's take what used to be called the Appeals Management Center in D.C. where all the remanded appeals were being adjudicated, or many of them. On average, and this is some years ago now, so data can change, but on average, that office was granting about 25% of the remands. And they were taking about a year and a half to do it. Except the cases I represented. The cases I represented were resolved typically within 6 months. And 50% were granted. Why? Okay, because I did not rely on VA to get the evidence. What would happen, I would get a copy of the BVA remand. I would call the local service officer and say, the Board of Veterans Appeals wants this evidence. Go get it and fax it to me today. And what would happen, the Appeals Management Center, which was called then, would mail a letter to the veteran and say, we have your remanded appeal and we're working it here. As soon as that letter comes out, I know the file is on the station. This is back in the paper days. And I would hunt down the file. I would review it. I would obtain from the service officer the evidence the BVA was interested in. I would then take the next step, develop and obtain any other evidence that I know is necessary for the right decision, and obtain that and submit it along with the evidence that the BVA was seeking. I even went to the next step of writing the rating decision and tabbing the evidence so the rater could see the evidence I was relying on for the points I was making in the decision. So the rater was faced with a choice. They could agree with me and take a very fast credit for getting a lot of work done, or they could take the time and check it out. And that would be fine too, because they'd find everything that I pointed to. And so by having the right evidence there and turning it into the rating team with that evidence, cut the time by 2/3 and doubled the grant rate. So it's important to have your evidence and turn it in.
Well, that there would be, I would think they could eliminate a lot of the backlog if a lot of other raters or techs would go through that same procedure. Why isn't that a common procedure within the VA?
Well, that was not within VA. I was working as a representative. I was representing remanded appeals. Okay. Yes, as a representative, as a service officer. I was developing the evidence. I was submitting the evidence. Now, if you find some offices around the country might have like some of their service organizations might have a staff of 2 people or 3 people, and they might be representing 3,000 claims. So they are as pressed for their time as the VA employees are. So it's hard for them to have the time to search for the evidence and to find it. A perfect example just came to mind. Veteran claimed PTSD, and he had been denied for years and years and years. No proof of the stressor, no proof of the stressor. This is before the days of the fear of hostile action liberalization. The story was he was with an artillery unit. He was sent with an advance party to relocate the fire base. While he was there, the original base was attacked and everybody was killed. And this gentleman suffered horribly with depression and survivor guilt and flashbacks and all that stuff. Suicidal. He was hospitalized for suicide attempts over and over again. He was just in bad shape. And I'm thinking to myself, now how can an artillery unit be wiped out and the Army doesn't have a record of it? It doesn't make sense. So I started digging through these records and saying, no, let's get the history. And something odd popped up. This fellow was a member of the National Guard. Well, back in the 60s, you know, I must say that I knew plenty of people who enlisted in the National Guard knowing they wouldn't be sent to Vietnam, okay? But in that case, I actually tracked down that artillery unit, and it actually was from a National Guard unit. I said, well, let's check out their webpage. I'll see if there's somebody I can contact there who can help us confirm the losses that unit suffered in Vietnam. A bit rare, but it did happen when Guard units did deploy there. So I went on their webpage. And when I opened the webpage and looked at the picture was a memorial to their soldiers who died in Vietnam in that combat action. And there were all their names. So it was really easy to confirm the death of all those soldiers. Won that case. You know. Sometimes you're just a mouse click away from finding what you need. Just a mouse click away. And I'm sorry to say, you know, if your development team is in a real rush and they got to get their points and they got to move this thing across, you might not have time to take that extra step for you. So it's in your best interest to make sure you got it.
Well, a lot of people wouldn't have thought of doing that, though, Bill.
Yeah. Well, it comes with experience. You know, I don't know if I mentioned this last time. Forgive me, I'll stop. But fellows claiming herbicide-related disease says he's set foot in Da Nang. You know, and been denied for years and years and years because there's no military record of it. So I thought about that for a moment, looked in his file, and granted it. Management questioned me about that, said, you don't have any military records documenting it. I said, well, let's go over it a little bit. Now, you see here's a fellow stationed in Southern California. Yeah. Okay, a few days later, where is he? Here it shows him on board USS Carl C. in the South China Sea at Yankee Station. Yeah. How'd he get there in those few days? How'd he do that? I don't know. Well, why don't you know? How can you even question me if you don't know how he got there? Well, what did he tell us, partner? He said he got a flight to Da Nang and then caught a hop to the carrier. How else is he going to get there? That's how it was done. You know, in the 1960s, we did not have an aircraft that could take off from Southern California and land on an aircraft carrier in the South China Sea. He had to land someplace and switch planes and take a hop out to the carrier. Da Nang was the base that supported the ships at Yankee Station. It was just 60 miles off the coast of Da Nang. Why don't you know that? That's anyhow.
Well, that's how things get done.
Yeah. But it comes with experience, and you know, I was part of a group that sent off was called the Crusty Old Drows, and they wanted young, malleable minds.
So Bill,
it was good.
So it boils down to the philosophy, you know, like if the raider or the person in the process is, like they said in the old days, you know, grant if you can, deny if you must. That's a positive leaning foot forward versus the other foot that says deny first, you know. So if you're trying to grant it, then you're going to go do the extra step and look at the record and look at the click and find the picture. And, you know, in my case, look at the medical record or try and advance the testing. And it's all about the philosophy of the person that's looking at the file.
Yes, absolutely. And there were times when I was at odds with other folks there because I wanted to invest more time. I wanted to do more development, and that was contrary to getting the cases done quickly. But I felt, that it's our duty. We need to do that.
Thank you all for listening. That ends this show. And now I'm going to zoom off.